Hi, everyone. This is John Benko, of course, the Director of Nursing at Belfair. What follows my short few words here is a video on how to properly don or put on an N95 respirator mask, how to remove that mask, how to put it in a paper bag for use again, and how to put it on once you've worn it more than once. This is important if we're deploying the N95 mask. That means that we may have some suspected cases of COVID-19. So out of an abundance of caution, we will issue these masks to any staff who could possibly come in contact with a person under investigation or someone who's positive with COVID-19. Wear the mask as appropriate. Make sure you follow all of the other precautions that we've been doing: proper screening, proper hand hygiene, sanitize the area, physical distancing. If someone is ill, they need to be isolated. They need to be away from all other people. So we need to make sure that client stays as isolated as possible until we get further instructions from the providers. That would be one of our doctors or someone who will have them seen. Most likely, if it's a person under investigation, we will be taking them off campus or bringing someone on campus to have them tested. They'll remain under investigation, under scrutiny, which means we'll continue to wear those N95 masks and enhanced precautions, keeping them isolated until we learn whether they are tested positive or negative. So we'll have more information on those clients as we get it. We may change their plan of care. In the meantime, again, isolation, strict measures, hand hygiene, physical distancing, isolation, sanitation, and make sure we're using personal protective equipment. Wear your mask. If you need to wear gloves, remember, gloves are worn once for a task and then disposed of. Use hand hygiene before and after taking gloves on and off. Certainly don't want to get any bodily fluids on you. If you do, you need to clean them off or wear a protective garment over it. If you have any questions, you can always reach out to me at benkoj@wingspancg.org. So here's a quick video on how to put that N95 mask on. Be safe. And again, I'm happy to answer any questions, and I'll talk to you soon.
Let's review proper use and reuse of the N95 respirator mask. First off, inspect your mask for any signs of moisture or damage. To don the respirator, place the respirator first over your nose and mouth. Pull the bottom strap and then the top strap over your head. Mold the respirator over the bridge of your nose. Press around the edge of the respirator to make sure there's a tight seal in place. Make sure you follow the donning process with hand hygiene. With the respirator and proper eye protection in place, you're now ready to see patients. To remove the respirator, tilt your head forward and first pull the bottom strap over your head, followed by the top strap. Keep the straps tight during the doffing process and avoid touching the front of the mask. Holding the respirator by the straps, place it into a clean paper bag. Avoid touching the inside of the respirator. Follow this with more hand hygiene. Make sure to write your name and the date on the outside of the bag. And remember, use a clean paper bag each time you reuse the respirator. The CDC recommends the use of clean, non-sterile gloves to put on a used respirator. To reuse a respirator, simply repeat the same process as for a clean one.